particularly acute because the hello and welcome viewers and thank you for joining me this morning, and we have for you World Bank Director in India Junaid Ahmad who's joining us this morning. Good morning, Junaid. Thank you for joining us here on Times Now. Junaid Ahmad, the World Bank has extended a $1 billion health line to India. I want to ask you, on a day when the world COVID-19 infections cross a million mark, how significant is this $1 billion assistance to India?
Navika, this is a very, very important partnership with Government of India. With the support of Ministry of Finance and the Ministry of Health, we have put forward $1 billion in partnership with Government of India to arrest the disease. The epicenter of disease cannot arrive in India, and we're supporting government's program to screen, to test, to support the PPE, the private equipments that nurses need, the doctors need, the citizens need, to build the ability of India's laboratories, to build community surveillance, to strengthen communities, to manage the onslaught, communications, the whole 9 yards to prevent, to stop and arrest the disease before it goes any further.
But Junaid, the criticism so far has been that India's numbers are low. It's crossed the 2,000 mark, but probably because we are not testing enough. How does the World Bank view the strategy that India has followed in terms of combating the onslaught of COVID-19? Are we testing enough? And the biggest question is the lockdown that has been announced by the Prime Minister helping to arrest COVID-19 infections across the country?
Navika, this is an unprecedented shock to the global system. It's an unprecedented shock to South Asia and to India. And I think countries and governments around the world are discovering how to address this. We've been working very closely with Government of India and supported by WHO that has really the knowledge base of how to deal with this kind of infectious disease. What's really different between the shock that you're seeing today globally versus, say, the financial shock that happened in 2009 is in a financial shock, you had an attack on the demand side of the economy, and all you needed to do was boost the economy. You stimulate the economy. Here, it's a supply shock. It's a health shock. In order to address the health shock, you actually have to hold back the economy. If you don't hold back the economy, you can't practice social distancing. You can't address the health issues. So it's a balance between addressing the health issues, slowing down the economy, making sure that you can bring the economy back again after you've dealt with the health crisis. It's this sequencing that is extremely, it's a balance, it's an art, and countries around the world are doing it differently. Let me just give you 3 quick examples. The United States is doing it bottom up. Each state is beginning a lockdown process, and it's adding up to the United States. Take Sweden, for example. Sweden has made a compact with its citizens and asking citizens to actually honor the system and themselves do a lockdown. India is the country that has done lockdown across the country, 1.3 billion, unprecedented, unheard of. So it is in that context, which is every one of these countries are following the same principle. You have to slow down the economy in order to flatten that curve in terms of the health. But the challenge is, how do you then come back into the economy as quickly as possible? What we have done is followed India's lead and put our $1 billion into that health expenditure, supporting the public health system to actually deal with this health crisis immediately so that the economy can come back as soon as possible.
What would be your recommendation and the World Bank's recommendation as far as the lockdown period itself is concerned? 21 days is what the Prime Minister announced about 10 days ago. Do you think 21 days will solve the problem? We'll be past the hump? we'll be able to have a resounding economy back again? Or do you think this 21 days will need to be extended, because many countries have experienced a second round of COVID-19 surge after the first lockdown when they've opened up? What do you think is best as far as the prescription for India is concerned?
I think you've answered the question in the question you have asked. There is no blueprint here. One doesn't have a solution that one can pull off the shelf. One has to discover on the ground what is happening with the health measures, and based on that, one has to decide the next step. Our credit line to India is precisely to ensure that testing is done in a mass scale, that protective gear is delivered in a mass scale, let there be no regret investment, if you will. Get people onto masks, get protection to the police force, get protection to the health workers, get community surveillance going. It's from that base that you'll get the information to know what is your next step. In a context of a health crisis like this, there are really three very important steps that needs to be followed. First, the health attack, which is what government of India is doing. Second is to create a social protection system, which is indeed embedded in the Pradhan Mantri Garib Kalyan Yojana, to actually enable that the vulnerable of society is able to manage this crisis until the health crisis is overcome. And then the third is to provide stability to the economy so that when the economy needs to lift off, it lifts off correctly. If you don't stabilize the economy, then it will not be ready for the liftoff. It's this three-pronged attack of health, social, and economics which needs to be done. And this is exactly what government of India is doing. And it has to be sequenced. You can't do the economic stabilization first. You really have to attack the health first. Then with the health, you have to come in with the social protection. And then finally with the stimulus. The word stimulus is wrong. It's stabilizing the economy before you begin the stimulus itself. And I think the government of India, in putting the 21 days, is precisely to allow that health impact to take forward, to learn from it, and then take the steps forward. And I think that's very clear in what the Prime Minister has said.
Mr. Ahmad, I also want to draw your attention to an article written by well-known economists who know the Indian context very well, Dinesh Kapoor from John Hopkins, as well as Arvind Subramaniam, the former chief economic advisor to the government. And both of them suggest that this might be the right time for us not to worry about a fiscal deficit, and fiscal deficits in many parts of the country could go as far as 10% of the GDP, because 4 to 5% is what India may need to spend on health services and feeding the poor, as you said in the Garib Kalyan Yojana. Do you think the World Bank is going to look at bypassing the FRBM targets, the fiscal deficit targets, at this point in time, especially when we are facing a world pandemic of this nature?
I think the global lesson that has come out is the role of the state is paramount in overcoming this crisis and bringing communities out of the crisis and getting the economy going. The state has reemerged as the big player, and social compact between the state and its citizens have now become extremely important. In that context, around the world, you're seeing countries spending 3% of GDP, 5% of GDP, United States 10% of GDP. The message is clear, and I think the message to the markets are very clear, that if the state doesn't step in to provide the support, you will not be able to move the markets and create the economic growth that everyone is looking towards. In that context, I think that India has a space. India's managed its stock of debt in a very careful way. It's not a stock of debt that is global. It is not a stock of debt that is short-term. Given that stock of debt, I think India has a space to increase anywhere from 3 to 5% of GDP into the economy. And that's exactly what they're doing. It's where you spend it is what's going to matter. How you spend it is what's going to matter. So you spend it on health expenditures. You spend it on communities, giving social protection. You give it to small and medium enterprise to stabilize them and get ready for what we hope will soon be the economic stimulus. So yes, the two economists you mentioned, whom you say know India very well, Navika, a lot of us know India very well, and I can tell you that today the state has to move in and do what it needs to do.
But what happens to the rating agencies, to the World Bank, to the International Monetary Funds, to the lenders really who are going to look at India from a point of view of the fiscal deficit also in terms of how healthy India is and rate accordingly? Do you think, I ask you this pointed question, do you think breaking the fiscal deficit target of 3.5% to the GDP which exists in the budget as of now is something that India can do without worrying, and international agencies will not look at this in a penal manner?
The World Bank is putting $1 billion in health in India today because it believes that India is moving in the right direction. Today, if the state does not invest in supporting the communities to address the health crisis, the economy of the future will be a weaker economy. The markets are intelligent enough to understand that. And I think that that's exactly what we need to see. I am not today worried.
Okay, we seem to have lost that Skype connection. We will try. Try and connect again to Mr. Junaid Ahmad, India Director of the World Bank. But one thing that he has applauded at this point in time is the fact that India is moving in the right direction, and India will need to follow a very strict regime in terms of the places where it spends its money in terms of the health requirements of the country, the health infrastructure of the country, the social coverage of the individuals, the citizens of this country, especially at a time when they have to keep their head above water without an income source. And then comes the economy stabilization, and post that the stimulus, and that, he says, India is following very rightly at this point. At least to that, Junaid Ahmad, the world director of the India director of the World Bank, seems to be giving India the thumbs up and the fact that India is probably playing it right. He also says that $1 billion that have been extended by the World Bank through a credit line is to see through the fact that testing really increases. India is able to buy more testing kits and spread the coverage of testing so as to find out the infected population. So Junaid Ahmad, I just want to ask you, there has been some amount of worry that has been expressed in several quarters on the population of India and the 1.7 lakh crores that has been part of the Jan Garib Kalyan Yojana. Do you think this money is enough and is actually going to reach the poor families that the government intends to target?
I think it's been very, very important that government announced the social protection program, because at this stage, you need to clearly ensure that those who are vulnerable, those who are poor, those who are in the unorganized sector, and remember that a lot of India's economy is in the unorganized sector, that the workers of those unorganized sectors, the informal sector, small and medium enterprise, actually are protected, that firms in those sectors are protected. So Government of India has announced a first phase of its program, the Pradhan Mantri Garib Kalyan Yojana. And I think that it is going to use that program and its strengths. What are its strengths? The technology, the unique Aadhaar ID, the People's Account, the Jan Dhan, the JAM. All of this enables India to actually deliver resources to individuals, to households in a direct way. The PDS is an incredible program of social safety net. What we did see that perhaps that more money needs to go towards migrants, more money needs to go towards the informal sector. We're today been asked by government of India to actually look at that program and to see where it can be strengthened. As I said, there is no blueprint in this kind of a situation. You have to take day by day, learn, adjust, and adapt. And I think that government of India, by moving fast on the health sector, by moving fast on creating a social protection system, is set the platform for what it needs to do next. So your question, is it enough? I hope it is enough. But if it isn't enough, the conversations that we're having with government is actually about strengthening those parts of the systems where it needs to be.
Mr. Junaid Ahmad, I would also like to ask you, because you're based out of Delhi, and many people have had this issue. You know, there was a sense of confidence till about 3 or 4 days ago that the lockdown was working and we'd been able to restrict the numbers of infected. But the recent development of some sort of breakdown in this lockdown came from a religious congregation that was happening, and the impact it has had, the Tablighi impact as it is being called, of people traveling across the length and breadth of India, and now several states reporting more numbers of infected people. Do you think this has upset the overall projections of how India would be able to control the onset and the infection rate of COVID-19?
Navika, I'm a citizen of Bangladesh. I'm a member of South Asia. I'm a resident of New Delhi. There is no doubt that whatever we do, it is to protect South Asia. It's to protect not only the countries of South Asia, but to prevent the epicenter from emerging in this part of the world. Because if it emerges here, it will affect the world. But this is a day-to-day fight. This is not something that, again, as I said, that there is a blueprint that you can follow. I'm not surprised that you've had communities take on the challenge, and I'm not surprised that you've seen outbreaks that are happening. That's why we have invested quite a bit of money in our program on community surveillance, public information, constant public information, getting to the communities, bringing them into the system of the surveillance. You know, India has an incredible story of self-help groups of women, incredible story of ASHA workers, Anganwadi workers. You begin to involve them in the community, and I think you'll begin to see the message going forward. Public communication, getting people to wear masks, putting out protective gears. These are simple things, washing hands, right? All of these are simple things, but these are things that need to be constantly communicated across communities. I don't think that this is an issue of any one group or any one specific community. This is about government communicating through its channels down to the grassroots level. Here, I must add something. India must unleash its federalism. The state governments know what's happening in their communities well. Government of Kerala, government of Tamil Nadu, government of Himachal, all of them need to be involved in this fight against the disease. They know their communities and they must engage in their communities. So I think the message there of public communications, community surveillance, which is very important in part of our program, needs to be strengthened and continue to expand.
Mr. Junaid Ahmad, my last question to B would be, has Indian economy paid the price, and is it going to pay a heavier price due to this lockdown? And what is the right stage at which the stabilization and the stimulus package needs to come in? Because many people feel that the economy, which was already in a slowdown situation with the lockdown, will find it very difficult to rebound. And many people have also joked about the fact that this time COVID-19 and the deaths that came with it it was a macabre joke, but it was made in China. But the fact is, even the cures, the pharma sector, coming from China at this point in time. How can India position itself to, get out of this lockdown, slowdown situation?
I think Paul Krugman, I think yesterday said that he expects the United States growth rates to fall significantly, global growth rates to fall, and we shouldn't be surprised. This is a massive shock into the economy, and it's a shock that has to be dealt with, as I said, first with health expenditure, protecting the poor, stabilizing the economy. What is very important about India is that it has the capacity in the private sector to repurpose the private sector into the health sector, into producing protective gear, into producing ventilators, into producing the type of medicine that India and the world needs. It has a research capacity that, in fact, could contribute to that magical vaccination that we are all after. Part of our engagement through this operation is to strengthen India's research system. So the platform that India has is being triggered and should be triggered. I think the surge that will come in terms of the research, in terms of the capacity into the public sector, lies inside the private sector, and that private sector can be repurposed. So I look towards the future of around the world of a reinvention of the relationship between the private sector and the public sector to really re-gear this economy towards a much better future. And I think that India has the research platform to actually go in that direction.
You haven't addressed the issue of when the government should come in with the intervention for stabilizing and stimulating the economy.
I don't think there's a particular time. I think it's a continuous issue. First, is your health story working? And you need to do the surveillance, you need to do the testing to understand whether the health story is working. As the health story begins to have its impact, you begin to bring people back into the economy. How you bring the people back into the economy is very, very important. There are many parts of the world which is saying, bring the young workers back because they're more resistant. Do testing, find out who has the antibodies, allow them to come back into the economy, right? Many of the small and medium enterprises that are service-oriented can come back slowly. So I think that there isn't a magic point in which you flip the switch and say, now the economy can be re-stimulated. But the fact that you're engaging today to get the economy to produce protective gears, to produce the medicine, all of that already builds in some aspect of the economic stimulus. The fact that you're giving a social protection schemes to the vulnerable and their expenditure will allow some aspect of the economy to grow. But I think until you're comfortable that the health measures are working, you really cannot expect the economic stimulus to work. That's why it's an ongoing story, and it's an ongoing story where you have to invest heavily in health, into community surveillance, into testing, and that will give you a sense of how to move in the economic sense. I wish I knew the exact date because I would share that with you today. It's not about an exact date. It's about understanding what's happening in the society, in the health system, and working accordingly.
Well, thank you very much, Mr. Junaid Ahmad, the India Director of World Bank, a man who understands India and is watching very closely how India is handling this pandemic in India. Thank you very much, Mr. Junaid Ahmad.
Thank you.
And we'll slip into a short break.